Bismillahirrahmanirrahim. Hello everybody. So this question consists of two parts. So first we will solve the part first. Then after solving the part first, we will go toward the part second. So let's the part one state that a 38-year-old woman, gravida 1/0, comes to the office for her first prenatal visit. Her last menstrual period was 12 weeks ago. The patient has a nausea and vomiting occasionally over the few weeks. Over the past few weeks, but no other symptoms. She has not seen a health care provider in years, but has no known medical condition and takes no medication. Supine blood pressure is 142 by 96 mm of Hg and 138 by 92 mm of Hg on repeat measurement 15 minutes later. Physical examination show a noxious woman with mild bilateral ankle edema and enlarged uterus. Ultrasound confirm an intrauterine pregnancy consistent with dates. A urine lysis dipstick is negative for protein and glucose. This patient returned to the office for a blood pressure measurement a week later, and her blood pressure is 152 by 106 mm of Hg. So which of the following is the most likely diagnosis in this patient? Choice A, chronic hypertension. Choice B, gestational hypertension. Choice C, normal pregnancy. Choice D, preeclampsia. Choice E, white coat syndrome. So this is a very easy question, as we know that this woman come to our office at her 12 week of gestation, because her last menstrual period was 12 weeks ago. So on this on this time period, the correct option here is choice A, chronic hypertension. Why chronic hypertension? Because in chronic hypertension there is a diagnostic criteria for chronic hypertension. I will write here. Chronic hypertension, in which the systolic blood pressure is more than or equal to 140 mm of Hg, and diastolic blood pressure is more than or equal to 90 mm of Hg, prior to conception or prior to 20 week of gestation. Prior to this point is very important. Prior to 20 week of gestation. 20 week of gestation, then we can consider as chronic hypertension. 20 week of gestation. This is the main point here, because as we already know that this female come to our office before 20 week of gestation. So the correct option here is chronic hypertension. So I will revise again. In chronic hypertension, there is the systolic blood pressure more than or equal to 140 mm of Hg, and diastolic blood pressure is more than or equal to 90 mm of Hg prior to conception or 20 week of gestation. To make a diagnosis of chronic hypertension during pregnancy, blood pressure should be elevated at two measurement taken more than or equal to 4 hours apart. This patient present with elevated blood pressure during two separate office visit, as I highlighted here. Two separate office visit before 20 week gestation and meets the criteria for chronic hypertension. So this is the correct option. Choice B, gestational hypertension. As we already know that gestational hypertension, in which new onset elevated blood pressure at more than or equal to 20 week of gestation with no proteinuria or end organ damage. This is the gestational hypertension. New onset hypertension more than or equal to 20 week of gestation. This is the gestational hypertension. Choice C, normal pregnancy. So as we already know that the normal pregnancy causes a vasodilation to increase the blood flow to every organ. So during normal pregnancy, due to vasodilation of the arteries, the blood pressure mainly drops 5 to 10 mm of Hg from the baseline. So this was also incorrect. Preeclampsia, as already explained to you, that preeclampsia is new onset hypertension more than or equal to 20 week of gestation with proteinuria or end organ damage. So this is preeclampsia. White coat hypertension. So white coat hypertension is a syndrome in which anxiety over medical care causes an elevation in blood pressure that is not present in other settings. White coat hypertension is very unlikely with this patient because in white coat hypertension, the diastolic blood pressure is more than or equal to 105 mm of Hg. So let's revise again why the choice is a correct in chronic hypertension. In chronic hypertension, we can diagnose a chronic hypertension if the female come before 20 week of gestation, not after 20 week of gestation. Before 20 week of gestation, with systolic blood pressure more than or equal to 140 mm of Hg and diastolic blood pressure more than or equal to 90 mm of Hg. So this is the chronic hypertension. Thank you.